Hi, team. I appreciate those of you who are here. What I want to do first is show you, while we're getting set up and getting ready, I want to show you where the links are going to be, because like I said, today we're just reviewing my material for the final. Do you know when the final is?
May 8th.
Yeah, it's your very last one. Let's not make this hard. There's going to be 40 questions. 28 of them are mine. The rest are a few from Dr. Haggerty's materials, some from Dr. Foles, and I think the others are from the oncology nutrition or oncology supplements, maybe. Before I quote myself, I should look. However, either way, most of it is mine. So what we're going to do today is review my questions. They're almost exactly the questions on the exam, with a caveat is that some of them I had to make fit the format of Kahoot. However, all the right answers are represented on the slide. So if it's not something that was on the slide, it means it wasn't a right answer, it's a distractor. And then some of them had more information in the exam, and I had to cut them down to fit Kahoot. So there might be a longer description, but the general gist is still the same. Before we get started, what questions do you all have? Nothing? You're just like, let's do this? I feel that. Okay.
I have a question, Dr. Moody.
Yes, Sahar.
About the PowerPoint of yoga and acupuncture.
Yes.
Are these in the exam as well, or?
No. Well, actually, classmates, colleagues, can you answer that question? Are they on the exam? No.
Okay. Thank you.
Yeah, that was something that I said, and you might have missed it, but I'm not going to have other guest lecturers on the exam. It was only from the material that I presented of the modalities lecture. Really quick, I want to look to see. I'm gonna look at this breakdown of the exam so I can tell you it really quick. So 40 questions. 12 from the modalities, 4 from probiotics from Dr. Haggerty, 14 of my natural products, 4 from the guest lecture for natural products in cancer, and 4 from Dr. Foles in diet and lifestyle. So that's 12, 4 times 3, 12 that are not me. So that means you should do well, right? Let's see, I have a question. Okay, so first things first, I'm going to share my screen so you can see where these are, because they're not open and visible to you yet. I'm going to do that after class so that you're not doing them at the same time. I don't want it to mess up for me. Okay, so if you see on this screen where the CAM modalities lecture is, underneath it, there is this CAM modalities Kahoot practice. Maybe you can see it now, maybe. Just don't click on it yet. So there's this CAM final Kahoot and this CAM natural products. This is the modalities questions. This is the natural products and supplement questions. These are all my questions. Play them, do them as much later. Do them as much as you want. This part. Introduction to modalities, only section on final. Okay. So you know where it is. I think this is when Brightspace is hard to navigate sometimes, so that's why I wanted to show you. Okay, next, we're gonna play Cahoots. So it might be helpful to have the 3 PowerPoint slide sets that I went over up. The majority of the dietary supplements and natural products questions are on the actual supplements, and there's 2 questions on regulations. But let's do that. I don't think I'm sharing the volume, the noise. Can you hear the noise?
No.
Do you want to hear the noise? I think it's annoying, but we can do that if you want. Yes, no, someone talk. Okay, wait. You like the noise? Okay.
Yeah.
Oh, you want
It
to know?
doesn't matter to me. So let's see. Do you hear it? Okay, I see some dancing. That means you hear it. I find these things very entertaining. For the person that's CMTM, is that comprehensive medication therapy management? Because that's a thing.
Those are initials.
Okay, but that makes a lot more sense too. But that's a thing. Do you get to pick your emoji?
Yes.
Okay. So silly. I think people are still logging in. Do we need to wait? There's one more. Oh, that's fun. Okay. I have 26, 27 of you. Does that mean the rest of you just want to watch? I'm fine with that. Whoa. Okay, let's just start. Let's go. This traditional Chinese medicine technique stimulates points in the body using various techniques. Okay, good. So massage is not a traditional Chinese medicine technique. There will be a question on massage later. Qigong is part of Chinese medicine, but it's more of a movement practice than a stimulation of points on the body using various techniques like acupuncture. What was the techniques that we talked about specifically or that time showed you? What was that? Needles? Yes. So that is acupuncture. If you have questions, ask or chat while we're going. Okay, next. Select the area of recent interest in CAM therapy for research. Okay. I think this is a tricky one, right? Because you probably were like, oh, definitely mental health. But remember, the data is older. So there haven't been any data points since, I don't know, 2018. So all the things that we would think would like mental health aren't included. The biggest focus, remember, was on pain. And if you think about the other healthcare crisis that is still kind of happening, the opioid epidemic, it kind of helps you remember that pain is a huge thing to focus on. Okay. Select the common characteristics of CAM according to the White House Commission on CAM. Okay, this one could get tricky because this is kind of specific, but one of the things that is common about CAM and complementary alternative practices is that they treat the whole person and they're focusing on the whole person. For example, focus on generalizable treatments. Remember, it's very individual and very individual specific. They are clearly not promoting pharmaceutical care. Not that they don't use it, but that's the complementary portion, right? And then intervention-based healing was kind of the random distractor that sounds right, but wasn't. Okay. This is a non-mainstream practice used in place of standard medical treatment. Okay, so you're going to see the definition of most of these except for healing medicine, which is something that I made up. So we're going to see the definition of complementary medicine, integrative medicine, and alternative medicine. In this case, the emphasis is on the in place, alternative to standard medical care. That's your cue, in place of, alternative. This ancient medical system originated in India, uses herbs, massage, and specialized diets in a complementary approach. Please don't say traditional Chinese medicine. Okay, somebody did, that's okay, maybe we weren't looking or maybe you clicked too fast. Traditional Chinese medicine originated in China. Ayurvedic medicine originated in India. Homeopathic medicine originated in a different country. Does anybody know where that was?
Great Britain?
Germany.
Germany. Good guess with Great Britain. Germany. And then naturopathic medicine, I don't know where that it originated. It wasn't one of our focuses, but we will talk about naturopathic medicine.
Africa.
So,
That one's Africa.
what?
Africa. Originated from Africa.
Naturopathic medicine?
Yeah.
Okay. I don't know. That wasn't one of the ones that I focused on because I don't know, but sounds good. I think the thing to remember with a lot of there is a lot of native and indigenous healing modalities that we didn't talk about that are used all around the world in different places. We focused on India and China because they are used above and beyond outside of those specific countries in more ubiquitous complementary and alternative methods across the world. So there are a lot more than what we discussed. Okay. This type of therapy is done using hands or devices to apply force to a joint of the spine. Okay, in this case, the confusing part here was the difference between chiropractic and osteopathic manipulation and massage. Massage only deals with soft tissue and muscles, as where when anything there's applying force to the joint of the spine, or bones, that's chiropractic and osteopathic manipulation. That would be the difference. What is being in a manipulated part of the body, bones and spine versus soft tissue and muscles. We will have a question on massage. Be ready. Okay, somebody's solid winner. Can't wait to find out who these people are. This is a non-standard medical practices that use together with conventional medicine. Okay, good. So this one, again, I made healing medicine up. FYI, Dr. Mood, they made that up. We already talked about alternative medicine that was in place of conventional medicine. In this case, the complementary medicine is used together with conventional medicine or complementary to conventional medicine. This type of medicine originated in Germany hundreds of years ago with the principle of like cures like. You've got this. Okay, good. Ayurvedic medicine, Ayurveda, we think of India. Homeopathic medicine originated in Germany, but if you didn't even know that, the principle of like cures like is homeopathic medicine. It also has the principle of dilutions, right? Okay. This type of practice brings conventional and complementary approaches together in a coordinated way. Good. So remember, in this case, we're really looking at the integrative medicine. I'm just going to guess that the people that guess something else just clicked the wrong thing. But when it's integrative, it's bringing conventional and complementary medicine together in a coordinated way, as opposed to like complementary, where maybe I'm doing something on the side, like my acupuncture, my doctor knows, but my doctor isn't prescribing it or part of the therapy. It's not part of it. I think an integrative medicine that makes sense that you might have heard about, and I think is oncology often, right? So where the oncology team includes some of the complementary alternative medicine practitioners, where in an integrative way, they do conventional therapy, but they also use complementary therapy to help treat the patient's pain and or symptoms from chemotherapy and the cancer itself. This technique is done by a therapist who presses, rubs, or manipulates the muscles and soft tissue using their body. Okay, good. This is So the key here is presses, rubs, manipulates muscles and soft tissue. Also, Tai Chi is one of those mind-body movements things, not something that someone does on their own, not something that's done by a therapist. This type of medicine is distinct primary care profession focused on treating the whole person. Okay, this is one that you might not have known. Traditional Chinese medicine isn't necessarily, it's a good guess, but it's not, it is focused on treating the whole person, but it's not a distinct primary care health profession. As where naturopathic medicine is a distinct primary care health profession and is such per the definition of the naturopathic medicine organizations. So that's the difference between the two, because traditional Chinese medicine includes acupuncture, herbs, all the different things, but it's usually not primary care. Recent interest in CAM has pushed an increased focus on research. What is the basis of this interest? Yes, I gave you 2 questions on the same thing. Okay, yeah, again, this is the same question, re-emphasizing that pain treatment and pain focus has been a huge issue. According to the National Complementary Integrative Health, most complementary approaches can be defined as fitting into these categories. This is select all. Okay, so in this case, the answer is that chart that we looked at a few times where it had the 3 different components and different aspects of nutritional, psychological, and physical. I made hydraulic up. Select the most common complementary health approach used among adults according to the 2012 study. Okay, good. So this might have been a guess for some of you, but this is a great segue into why we spent so much time focusing on natural products, because natural products, according to that study in 2012, were the most common complementary and alternative health approaches. All of these on here are health approaches in the top 10, but natural products was number 1 by far. Okay, let's see who won. Whoever these people are. Who is CM?
That's me.
Kayla, that makes sense. That makes sense. Those are your initials. That makes sense. Thank you to all of you who played. Hopefully this was helpful. Again, this is posted so you can play this all that you want. I'm just gonna say, we did it today, we reviewed it today. Play this on Sunday or Monday next week after everything else is over. Don't worry about this for now, right? Okay. We're going to transition to the next one. Okay, hopefully you should hear sound. Yes, sound. Okay, thank you for the head nods. Godiva, I like that one. I like that. P4 bound, hey. Am I waiting on anybody else? Yeah, right, sepsis. Anyone else ready to start? I'm just gonna do it. Here we go. So this is dietary supplements and regulations, natural products. When talking to a patient about dietary supplements, which points should you share? Okay, this one might have been hard to read through those. This would be an example of not the easiest to convert to a question, but yes, most of you got it right. Let your provider know that what dietary supplements you are taking to check for interactions. Dietary supplements and natural products, in this case, I'm using in the same umbrella. This one, so the red question on here, products with many active ingredients are the best. On the actual exam, the answer is much longer and makes it sound much more wrong. And then let's look at that green one. The FDA regulates dietary supplements similarly to prescription products. What's wrong about that? Does the FDA?
It is a lie.
No.
It is a lie.
Correct.
Hey.
Thank you. They do not. That's the whole point. Okay. Ooh, I wish we knew what that emoji was supposed to be. When talking to a colleague about melatonin supplements, which points could you share? Which are correct? It's only one. Good. So this one is the use of melatonin, right? Often used to prevention of insomnia related to travel or shift work. The doses of 20 milligrams or higher have been shown to be best for sleep. Just FYI, that's very wrong. I have seen an older patient and I might have told you this, I don't know, but I think it's worth telling again. I have had an older patient who is taking like 20 milligrams of melatonin regularly for sleep, and she was having psychosis. Like seeing things, it was scary. That's what happens if you get too much melatonin. So the normal dose of melatonin is more like 1 to 2 or 1 to 5 milligrams, not 20. Sometimes it's even less than 1. The FDA approval for use in children, does melatonin get FDA approved? No.
Dr. Moody,
Yes.
I just have a question. Can you please repeat what happens if you take too much of the melatonin?
Oh, I just gave an example of a patient who had psychosis from taking like massive doses.
Okay.
But things do happen. You do have mental disturbances. And not everybody, because everybody's going to respond differently, but it's not good.
Okay, because I know like over the counter, usually it's like 5 milligrams.
Yep.
And like sometimes I personally use the 10 milligrams. And that's why like I wanted you to like repeat what happens if you take like maybe like 2 pills of the 10 milligrams.
I would not do that.
Okay.
Honestly, the normal supplemental dose that most that I've seen for most recommendations is more like 0.3 milligrams.
That's
this
good
is
to know.
where-
Thank you.
Yeah, melatonin works sometimes, but it's not the best. And the data is okay, but definitely don't use high doses.
Okay, that's good to know. Thank you.
Okay. Which of the following points about echinacea would be the best to share with a patient? You might not know this one. We'll see. Okay, good. This echinacea is one of those asterase family flowering supplements to worry about. I'm glad some of you got tripped up by the red one, which is take at least 36 hours after cold symptoms appear. This is one of the ones that you need to use before cold symptoms appear. And then 36 hours is a longer time frame, but this one is the one you want to take in advance. It also is the one where they use other parts of the plant, and I think it only limits the cold duration by like a day. So this one is avoid if allergic to asterase family, which is a flower. Kayla's easing her way back up there. Which counseling point about saw palmetto supplements would be the best to share with a patient? Okay, good. You might have gotten tricked by the saw palmetto works similarly to alpha-1 blockers, because we did talk about that for something, but that wasn't this. If a patient is suspected of having BPH, which is why someone would potentially reach for saw palmetto, they should see a PCP before trying dietary supplements. That is the correct answer. This is an example of one where I had to create a fourth option, but on the exam does not have a fourth option. The fourth option is obviously none of the above. So I don't like those on real test questions. When talking to a colleague about cranberry, which points could you share? Which statement is true? Okay, good. Hopefully you could at least eliminate the bactericidal and effective for treating UTIs. Remember, in general, cranberry isn't used to treat anything. It's used to help prevent UTIs by decreasing bacterial adhesion to urinary tract. That's the specifics for that one. It doesn't treat UTIs, it helps prevent them. Which of the following points about green tea would be best to share with a patient? Okay, good. This one is that one tea bag contains on average about 24 to 40 milligrams of caffeine. I think the other ones were really good distractions, which is why I put them on here. So we're practicing them and you will know these. I am looking for this slide specifically because I want to show it to you. Okay. This one is, I think it's easy to fall into like guessing the INR patient one because you're like, oh, there were so many. And this one does start with a G, right? But this wasn't one of the ones that had increased risk of bleeding specifically. We're more worried about GI upset, CNS cardiac stimulation, warfarin antagonism, but not specifically worried about INR as much as the T-bag part. I think in the actual one, I removed that increased INR in patient question. If not, I will, to make it easy, more clear. Which of the following points would be best to share about a colleague with CoQ10? Okay, good. CoQ10 is most commonly used as a to limit statin-associated adverse effects. Which adverse effect, does anybody know?
Myopathy.
Yes, myopathy. So the muscle pains and muscle problems. Good. Select the side effects associated with garlic supplementation. This is select all. It is also a select all on the exam. Okay. The only one that was your teaser in here was skin color changes. That is not correct. Everything else is correct. Heartburn, GI effects is correct. Bad breath and body odor, if you've ever eaten garlic, the stinky part of the garlic is the part that makes it effective. So if it's not stinky, it doesn't have the thing that you want in it. It does cause bad breath and body odor. And thank you for knowing that this is one of the G's that absolutely increases risk of bleeding. So it was all three: red, yellow, blue. Green is made up and incorrect. Which counseling points regarding fish oil would be best to share with a patient? Okay, my random, this is not on the exam. This is only 3 answers. All of the above is not an answer. So it was easy to fall into all of the above, but hopefully you saw fish oil increases the risk of bleeding. So I highlighted it, or I bolded a word in that red writing: side effects including increased clot risk. So you probably missed that because you were going too fast because you wanted the points, but that eliminates the all of the above in green. So on the exam, this is only 3 questions. And the answer is store in the refrigerator to reduce fishy smell. It doesn't have the greatest effects for lowering LDL. That's not what it's used for. And that's not where the data is. So this one is store in the refrigerator to reduce fishy smell. Red yeast rice is most similar to what prescription medication? Okay, it was definitely a statin, right? It is lovastatin. Lovastatin, red yeast rice. Maybe this would be a way to think about this. Have you had cardio yet? Yes, you've had cardio, your P3s. Ha ha ha. It's not going to be a high intensity statin, right? So hopefully you think it's not going to be a moderate to high intensity statin. So eliminating rosuvastatin and atorvastatin off the bat, it's going to be a low intensity statin, leaving only simvastatin and lovastatin. And in this case, it's lovastatin. If it worked like a high intensity statin, everybody would be using red yeast rice. What supplement derived from shellfish is commonly used for knee osteoarthritis? Okay, good. It's glucosamine. So devil's claw was kind of just a throw in there to something we talked about, but not for osteoarthritis. The two that we talked about specifically for osteoarthritis on this list were the methylsulfonyl methane, the MSM, and the glucosamine. And glucosamine is specifically the shellfish derived product. So glucosamine, shellfish. So you have to worry about glucosamine if someone has a shellfish allergy. Ibuprofen. Someone got click happy. Select the true statement about St. John's wort. This is select all. Okay, so I'm so happy that most of you selected the blue many drug interactions with 3A4 induction. Yes, absolutely. But you also want to avoid it with other serotonergic agents, as it does have serotonergic properties. So both of those are correct. This regulation defined dietary supplements. Okay, even if you can't remember this, there's one word in here. Oh, it didn't let you select all. Bummer. Well, that's my error on the good to know, Daphne. That is an issue. I just keyed the Kahoot wrong, but on the actual exam, it is a select all, and it is 2 of the answers. This regulation defined dietary supplements. Even if you didn't know these, hopefully you looked and said, huh, that one starts with DS. I'm going to guess that, and you would be correct. The dietary supplements, it's Dietary Supplement Health Education Act. Okay, last one. Select the inappropriate dietary supplement label claim. Good. Hopefully you realize that nothing that's a supplement should say cures or cures anything, right? Dietary supplements cannot do that. See who our winner was? I think it's Kayla again. Kayla, just really rocking it. Who's P4 bound?
It's me.
Ah, thank you, Claudia. Okay. And who's MC?
Me.
Awesome. Thank you so much. Okay. Congratulations to all of you, those of you who won. If you were just here watching, that's okay. I'm going to fix the key for that one question and make sure that you can select all. Don't stress. Oh, can you still hear the music? I can still hear the music. Kind of annoying. Okay. Don't worry about this exam until next weekend, right? You've got this. You've got most of the questions. Good luck. Practice next week. Let me know if you have any questions or need anything, but good luck on exams. Talk to you, I don't know, I'll see you at the exam.
Thank you, Dr. Moody. And I think it was for all of the select, all of the apply. We just,
They all did it?
yeah. You
Good
only
to
said,
know, thank you. Good to know.
thank you.
Doctor, are we done?
Yep, we're done.
Thank you so much.
Mhm.